So let me ask you a more business question. So did you ever get to break even or even profitability before then?
No. So we never, and it was interesting because that was actually one of the discussion points that we had. Because when we did our model from the beginning, we were going to get break even at 150 pharmacies.
Oh wow!
Because I think our model was optimistic.
By far.
Because we expected all these tests that weren't being done. Like we felt like once you put up this ability for people to actually test conveniently, they just go and do it. Right, and then we get to that point and we realize, and then we get to 500 pharmacies, we are nowhere near.
So today we're back in Accra to have a great conversation with Andrew Quao, the current co-founder and CEO of RIGELIS. But here we're really going to talk about a startup that was quite prominent in Ghana and that had some challenges, so some opportunities. And we'll see what Andrew is going to tell us about them now. So welcome to Talk, Tales of an African CEO. Andrew, welcome to the show.
Thank you very much, Steve. It's nice meeting you again.
Thank you. So the whole idea today is really to talk about the opportunity in healthcare, your past, what you've done before. Why did you set up the company? You tell the company, I don't want to tell the audience yet. And then, what was the story, the dynamics, and then tell us stories and tales about what happened, and then why you went on to set up this new company.
All right. Yeah. So thanks for the question. So a bit of my background, I'm a pharmacist, so I trained in healthcare. I'll say I got there by chance, like being a pharmacist. High school, wanted to go to uni, and then my friend said, look, don't do pharmacy. You're not gonna have any time. It's so difficult. And I'm like, sign me up. I was 17 years.
Oh wow, okay.
And I just took that up. So growing up, I wanted to be engineering, aeronautic engineer or something. But I just picked the challenge as a young boy, hot-blooded, and went through pharmacy school. But then in pharmacy school, it was recently that I go back to that. So in pharmacy school, the first year, we had this lecturer, Professor Ibu Mensa. And he did ask us a question in pharmacy school. So at that point, that time in 2002, you could only do like 100 pharmacies a year in Ghana because the only training institution was KNUST.
Okay.
So we had a computer science that was starting. And the computer science class was about like 30. They could do about 80, but only 30 people applied for that. That's 2000. So nobody really wanted to do computer science. So he asked us one question one day, is like, so we have this opportunity and we've taken one of the 100 slots. How would we feel if after this course, one of us decides that I want to do computer science instead of doing the pharmacy? And the whole class was like, this is so insane because if you want to do computer science, they have a class of 30, there's more room, and the grades for pharmacy are actually higher or more stringent to get into pharmacy school. Why don't you go do computer science? So like that. So unanimous decision from the class.
Yeah.
And he looked at us and said, you guys are wrong. And we said, why? And he said, look, it is only a pharmacist that can do a software for pharmacists that pharmacists would understand. No one is going to be able to study computer science and do a software for pharmacists as much as pharmacists could understand.
Yeah.
And this was something I brushed aside. 2002. It dawned on me after in the 2016s there, I realized he was telling the truth. So post-pharmacy, did some entrepreneurship stints, local entrepreneurship. We did some training for University of Ghana students. We trained almost over 10,000 students in 2 years. So my co-founder and we all decided to go to the States. He's still in the States. So we went for an upgrade. He did petroleum engineering. I still wanted a healthcare, so I did public health. And then came back, did some work for the USAID. Alongside some dev work, so some development. So we did biometric voting software in 2011. That was way before anyone could do that.
Wait. Now I'm shocked. So you trained as a pharmacist?
Yes.
But then why were you developing software?
Because that's why I gave you the first part. It's kind of what is embedded in me. I felt and it was exciting. I think when I took that challenge, it was exciting. So for me, my work in pharmacy was not like, I did a bit of retail pharmacy because that was required as part of your professional qualification. Post that, I did like entrepreneurship because I come from a family background where like my foster parents, they do trade in FMCG goods, so rice, big in Kumasi and all that. So I think I grew up from that, and I love that. I love the banking aspects and all that. So I wanted to do public health because when I wanted to do my master's, I still felt like I wanted to do something that gave me the opportunity to be able to impact.
Yes.
I felt being in a pharmacy, one pharmacy, I still would make the impact, but I felt like it was like, you've got a market that you capture, but like something like public health puts you in a position where you can like do policy, you can do like
more systemic
things, exactly. So that is how come I did that. I did a public health, came back, was still doing my entrepreneurship things, and then like did some work for USAID on a nationwide malaria project for 6 years. Whilst doing that, I was also doing like biometric voting systems. So we did Quao, Ghana Law School, University of Ghana. We really enjoyed that. Wow. And then, so when
when you were doing that, sorry to interrupt. So that means that, so you were a professional. Yeah. But while you were doing that, you were doing side gigs as a software developer, all these biometric things, etc., correct?
Yes. So I wasn't actually developing the software.
Okay.
So I was telling them how to develop the software, which is exactly what I've done at RedBird. I'm still doing now. Okay. So for me, I felt the same thing, the pharmacy thing. Like I felt like coding limits me. Because like I have to like do a page, and then I have to like make the page, analyze them. I felt like I could tell somebody make this page this way. So I could do like 10 pages in one. So it was, I think somewhere when so I did 2 projects with the USAID. I did the first one. And we did the second one. So the first one I actually joined at the tail, and then we did the second one. So whilst the second one was coming to an end, like if you are familiar with this USAID project, it's like projects, so people jump ship before the ship stops. It doesn't tank, it just stops, right? People sort of, but like when I was living there, I came across the Impact Hub, right? So they were having a hackathon, a healthcare hackathon, and I really felt like there's so much that could be done in pharmacy. So I put together something in the pharmacy space, sort of like supply chain with the pharmacy. So we did a pitch. I entered a competition with my current CTO, and one of our friends, Bernard, is outside now. So we went in. We went all the way through to the final.
Oh wow!
So we went to the final. And
which way was this?
Impact Hub.
Yes, that final thing. Which year
so it was a Maerck hackathon. I think it would be in 2016.
2016.
Yeah, 2016.
Oh wow! It was a Maerck one.
It's a Maerck, it's a Maerck hackathon. Hackathon. So we got in. We got all the way to the final. We didn't win, which always happens. Sometimes happens. We didn't win.
Who won, if you remember?
So this guy is called Randy.
The company?
I think Crowd Africa or something.
It wasn't the healthcare one then.
It was a crowdsourcing gig to help like people pay for healthcare. So it was still geared towards healthcare. I mean, they won. He won. He later actually worked a bit for us at RedBird. So he won. We didn't win. So I pitched at the final. And my co-founder at RedBird, Patrick, that's how we met. So he was actually one of the judges.
Nice.
So he wasn't a judge. He was one of the advisors. So I pitched at the final. So I mounted the stage, did my thing, and he'd been in Ghana for like 2 years. He went to Oxford, so he had a startup in the US, exited, and went to Oxford for social entrepreneurship because he had all this early concept of RedBird. So that was his drive. So he actually took a job from a Tanzanian company to set up their company in Ghana. Basically, so that he could study the market and know what to do. So like he was on that and was like looking for someone to partner with. Right? So when I pitched. I mean, we didn't win, that was fine. So after the pitch, he walked up to me, was like, I feel like we need to talk. Let's talk. But he's traveling. When he gets back, we can talk. So we pitched, we connected, and then we got back. So I think that's the beginning of RedBird. So he came back. We scheduled to meet. We actually met at Accra Mall, and it was funny because
Accra Mall back in the days was the meeting place.
Yeah, so we met in Accra Mall, and it was funny because it's just like the way you and I meet, right?
Yeah.
So hey, where are you? And then we met somewhere around the cinema, and then we both had a seat.
Yeah.
We didn't ask each other like, do we want to take some drink or something?
No.
And just at the same time, we both started pitching. So basically, I entered the meeting thinking this is someone that was interested in my idea that I pitched at the hackathon. And he was like, no, like I found someone that I could partner with.
Yes.
So basically, like we both started pitching and then we had to stop.
Yeah, exactly.
Because they're like, wait, okay.
So you're not looking for the same thing.
So then we just talked. And then, so I mean, we thought we got on, and then I think we got on very well. Yeah. And then he had connections as well.
Yeah.
So we got some consultant from Bain.
Yeah.
So I work with that consultant to sort of like do the groundwork, the feasibility studies and all that. And I think we did a good job on that. Tim did a very good job also for us.
Yeah.
It was interesting because when he done everything, almost everything was tallying. And there was one point, I remember the last conversation we had, there was one thing that wasn't tallying. And he's like, oh yeah, so he's done all these big things and like this is the number of malaria cases. And I'm like, no, this is off. I've worked with the Ghana Health Service. This looks like half. So like we kept going back and forth. And then I was like, I get it, Tim. All the data that we've done, the WHO data that we have is public sector. We've done
private sector.
So there's nothing on private sector. So basically, because the number was, it wasn't off, like, so it's like when you're expecting, let's say 3,000 and somebody gives you 600, you can't do anything with that. But you're expecting 3,000 and you get 1,005. And you know, like, no, it's supposed to be 3,000 and I'm getting exactly half. So like we go through everything and everything is perfect. And then we just realize the country's healthcare is actually divided into two. It's like half public, half private. And we didn't have any data on private. So that's kind of like, it's reinforced the decision in very early days to do RedBird, because then we could get private sector data to complement
the public sector one.
Yeah, so
if the public sector one is complete.
So I mean, it gives you a sort of a semblance, because like the WHO data that we picked were all public sector. There was nothing private sector on that. So that is how come we sort of like look at it. We look at the math on that. At that point, the math was looking good. Yeah, it was looking good. We thought of a couple of things to do with the pharmacies, and we quickly realized that pharmacies in Ghana sell drugs. They don't do tests, right? So we wanted a foothold into the pharmacies. And we thought that with a test, we are not going to be competing with anyone.
So nobody was doing it. So you had a whole market for yourself.
So like if we try to like sell drugs, like you can see any scammers, like they are startups selling, I don't want to mention names, but like they're startups selling drugs, like you'd already get a competition. So we figured out, okay, you know what? We go into the pharmacies with a care model. Which was like a diagnostics. You guys already have the test kits, you guys already have the medicines, you know how to do this. So you go into the pharmacies.
And one of the things that I've also noticed in the space is that because we tend to self-medicate without doing diagnostics before, that was a massive, and still for me is a massive value proposition. That's number one. Number two, a lot of people are reluctant to go to hospitals, but once you're there, guess what? A lot of the hospitals have their own pharmacy. So once you start going to the hospital to do a diagnostics, the pharmacy attached to the hospital has already captured your customer as a pharmacy. So you now go back to that pharmacy that sent you to a hospital. So there's a whole, care journey that doesn't happen.
And it was because when we looked at what we did in the beginning was we actually looked at the potential. We didn't look at what was going on. We looked at the potential. So for example,
maybe for the audience, in two lines, the elevator pitch for RedBird.
Yes, so I was going to come to that. Basically for RedBird, what we want is convenient healthcare to fit your lifestyle. So we wanted a convenient place for you to access your healthcare, where healthcare would mean not only self-medication like you mentioned, but then you'd also be able to do your diagnosis. And then if you need to manage your health, the pharmacy is an easy place for you to be able to manage your health. So that was sort of like the elevator pitch for RedBird. So making fitting like your healthcare into your lifestyle, so that you don't have to for example, go to a hospital, because in 2016, 2017, going to the hospital is like half a day, right? And then so if you are, let's say, a diabetic, And anytime you have to go for a hospital checkup, like it's half a day gone. Or sometimes you go to a hospital, all the doctor does is like they check your sugar levels and all that. So you could actually do that in your pharmacy.
Or at home.
At home, yeah. And then at a point, like connects you to your doctor.
Yeah.
That was sort of the future vision for RedBird.
Yeah.
So we did that, and I think it was sort of paired with the fact that like chronic disease was going up in Africa. So we have something they call the ecological transition, where you have like the acute diseases give way to chronic diseases. Yes. So like the more the country develops, you realize that you solve the malarias and all that, and now like your disease burden goes into chronic.
Yeah. Because it's lifestyle based, sugar, all these other things.
Yeah, and the thing that we realized very early on was that even if you look at the African healthcare space at that point, right, which was dealing with acute conditions, it's choked.
Yeah.
And when you take an acute condition, like let's say you take malaria, when I get malaria, I go to a hospital, I get treated, I leave.
Yeah.
So the space becomes available for who? You to go. When someone else gets diabetes, they don't leave. So it's
constituents,
recurrent. It's just recurrent. So if 5 people get diabetes, that's like 5 new people that have been added to the healthcare space. Yeah. So we realized that like the hospitals, the infrastructure wise, like once we get there, so the idea is like let's build something that is convenient and use something that is already existing. Because one of the things also we realized that when you go to typical pharmacies, they spend about like 30% of their time actually dispensing medication. The rest of the time they are sitting down. Yeah. So we thought that in our value proposition, we thought that there was enough time for the pharmacies to do more. And we saw that. So we launched RedBird. We did some pilots.
Why RedBird, by the way?
The name.
Yes.
So that was from Patrick, right? When he left his company, he wanted to form a company. And like he was having a drink with his friends, like, what are you going to call it? Yeah. And then I think they saw a RedBird. And somebody just made a joke like, that RedBird. Like you can just name it that RedBird. Like, and it's not, that is, so when we sat down, like the name came up. And we, first of all, like, it's not because they said that, but we had to sort of think whether like this actually fits what we're trying to do.
Yes.
And if you look at what we're trying to do, sort of like, it's a bird hops from one place to the other. Yeah, and then red like stands for blood.
Yes.
Right, so we basically felt like, okay, like, yes, that might have been in a funny, like in the gist of the moment, but like, it actually fits, like, because it's a bird that allows you to sort of like hop from healthcare providers to other healthcare providers. So.
I actually had a very different explanation to your name without knowing that initially. I was thinking because the RedBird, the way you've done it, looks like a phoenix.
Okay.
So your healthcare can be reborn like a phoenix that reborns from ashes.
Okay, that's good.
It was a bit more perfect.
If we knew that, we would have added it. But like the idea behind the inspiration mostly like was Patrick. And we felt like, look, the name. And also we didn't want something health. We didn't want like something pharma. We didn't want like something diagnostic. Like we wanted, and then we wanted a name that. This is the vision, right? The vision was we were going to start with the healthcare, but we wanted a name that does not limit us.
Okay.
So like as we scale, whatever we want to go into, we can easily go into that. Like if we, so we don't have to always like if we decided that we do healthcare plus something, then it's like, oh, now you have to change this company name or have to create another. So we just took a generic name, which is kind of like informed the new company as well, like just generic on that.
Maybe we didn't talk about it too much, but. Look, I'm sure during this founder entrepreneurship journey, up until where we are, where you stopped at, have there been any interesting stories, challenges, or things that come to mind that were really out of the ordinary? Like,
Well, this is a lot. I mean, I tell people like a founder relationship is like marriage. Like it has everything, like because it's like you spend so much time with your founders, your co-founders, that like it's like everything happens, like the good, the bad, like the ugly, like everything happens. I think interesting. The beginning would be perspective, right? So me coming from Ghana, coming from a business family background, like what I know is. You take A, you put 5% on it, you sell it, you make 5%. Right? That's kind of like a business.
Trading.
Typical trading. Buy and sell. Or you're doing in a business like you see the profit.
Yeah.
Like I cannot imagine going to like any family meeting and saying, oh, like I need like $1 million. I will need more. I'm not going to bring you back $1 million. Like anytime you mention $1 million, somebody knows like you're going to make 1.5.
Yeah.
So it was kind of interesting because in the beginning, in my mind, when we started talking about RedBird, we all agreed on the concept.
Yeah.
But my mind was like, yeah, we needed to like just buy test kits, sell the test kits, and then we make more money. That is how we survive, right?
Yeah.
But then it was interesting because we got our first funding from Grey Matters collapse, and that was like we had 2 pharmacies.
Okay. Wow.
That's
very early.
Yeah, and it was $200,000 or $250,000.
Okay.
We had 2 pharmacies, and this is something that I share with people. Something profound happened because when first of all, it was a women-focused fund.
Who invested, guys?
Yes. So first of all, it was a women-focused fund, right? So they were like women. They said women-focused. They didn't say women founder-focused. They said women-focused.
Okay. So your end customers could have been women.
So basically, we had to now fit ourselves into their fund, right? So we explained to our end customers are women because it's women who normally care for the kids and all that. You're saving them time. And then when we looked at our pharmacies, majority of the owners are actually women.
Really?
Yeah. So majority of the pharmacy managers are actually women, like men.
Managers, but not owners.
Not owners, managers. So the managers are women, and if you look at the staff is like 70-80% women.
Exactly.
Yeah. Okay. So basically, yes, we weren't that
off.
Even though we're not women founders, our system was actually. But we were frank to them in the beginning. We said, look, what we are doing caters for women.
Yeah.
Right. And it's good to be forthright because I think investors, and I think one of the things that some of us don't understand is like we try to play the investors. These guys are smart. Right. So we were forthright. We said, look, we do not have in our mission to be like, oh, we are providing a solution for women. But the mission that we are doing actually helps women.
Yes.
Right.
In terms of employment.
And all that, and the people, all that actually helps women. So our focus, we're able to sort of like pull up and said, okay, this is the impact that we have on women.
Yeah.
But then when we did our projections and we did everything and we spoke to them and they went to IC and then we spoke to their board, the CEO. And he mentioned something. He said, look, this is all hazy, right?
Your startup is normal.
Yeah, he's like, this is all hazy. But I'm going to put the money in the company, not because of what you guys are telling me, because the team knows what they're doing. And I believe in the team. I can see this is a team that would get this right.
Okay.
Right. And that is very profound because, like you're saying, startups are hazy. You start on something and hardly do you finish what you started. Yeah, it's always with the pivot and all that. So we got that funding. And so when we got that funding, for me as an African, that was another moment. I was like, we've got 250K. And Patrick's like, no, we need to go to an accelerator. And I'm like, no, we've got 250K.
You can operate and make
why
money.
do you need to go to an accelerator? Like it doesn't.
Yeah.
It's not a way I would go. As an African operator, it's not a way I would go. And it's like, no, we need to go. So we got into an accelerator, the same accelerator that Informa went to, Alchemist Accelerator. So we are the second African company to get in there.
Yeah.
So we got in and then we flew into San Francisco. It was like really abrupt because it was like March and the project like April we go like I have kids.
Wow.
So like I basically had to leave my family in 2 weeks. It's like, we go to San Francisco. Okay, so we get on the plane, we get to San Francisco, and it's interesting. The first meeting that we had, so we're sitting in the room with like these angels and founders, and like everybody's trying to introduce themselves. Like, I introduced myself as a pharmacist, blah, blah, blah. Like, nah. People started introducing like, I made my first like 100 million at 21. and somebody said, come down, I made it at 20. And like that basically just makes you fill the room.
Yes.
Like those guys are not talking exactly about what you want to hear. Like they came for training. But then the second thing that jumped out of that meeting was that they literally blew away the perception that we needed to sell to make money. Like at the startup. They basically are like, no, you need to build a vehicle that can make the money. So like they give the examples of like Ubers and all that. Because in the beginning, like so basically, and after that, I remember telling Patrick, like, I now understand why we came here. Like, I honestly, like, on the plane, I was still simmering, like, why we have 250K and still come here. But like, that was one of the things that that came in, and we went on for a while. In the beginning, it was good, and it caught fire. I would say like because people really love it. Like even as I go around now, like you still see a lot of people loving RedBird.
Yeah.
It was okay. It caught fire, and at the point, I think maybe we got too like
excited
because I think that this is a point where, and I say this like it's you're being successful as a startup or as an entrepreneur, but you need to make sure
you keep going.
You keep going. You need to make sure like at the thing that otherwise like the success that you have now
goes to your head.
And it doesn't. It gets to a stop.
Yeah.
So basically, like I look at RedBird, and we did a lot of things. I remember after like the fundraise, the first fundraise, we did some fundraise at the accelerator. We did almost a $1.5 million raise seed round. And I remember after the seed round, I don't know what happened to me, but I basically felt like no, we needed to do something else.
Oh really? You want to change already?
No, not that we wanted to change. I felt like we needed something plus.
Okay.
And it was hard to argue against. Because here is a case where you've grown your pharmacy numbers from like 70 to like 300. So, and you're growing. Like pharmacies are literally saying, take my money. Take my money. So, and we don't know what exactly it was, but like we felt like, look, we needed to do something. That's what I felt. I had my disagreements with Patrick and Ed and all that. I felt that we needed, and Patrick also felt like we needed to keep on this goal before. Right. So I think that was kind of like, and that was
where
the
tension.
That's where the tensions began.
So let's pause just for 1 second on that. So RedBird started, remind me, in 2019.
Yeah, 2019.
Yeah.
No, 2018.
2018.
Yeah.
It grew all the way to, let's say, post-COVID, 2021. Yeah. COVID must have been great for you guys, no?
So when the COVID happened, it wasn't great for us.
Oh, really?
It wasn't great for us and great for us. So it's two ways, right?
Okay.
So when the COVID happened, what we realized, our tests is like people have to go to the pharmacies to take a test.
Yeah.
And I COVID like it was like you can't
go to the pharmacy.
You can't do tests remote.
Yeah.
So like our numbers, sales numbers, everything dropped.
Yeah.
So I mean, we pivoted with we tried to do like the COVID app.
Yes.
Where people could actually record their symptoms so that. But then the government also had its own ideas.
Yeah.
So we got that, but then I think that also gave us a reach. So the investors that we actually had, they saw the COVID reach that we were having.
Yeah.
And then that's kind of what actually catapulted, because I mean, post-COVID, like fortunately for us, COVID wasn't like in Ghana, COVID wasn't like too long. Yeah. So then that helped us. But then when COVID struck, I think for us it was like we needed to reorganize. Yeah. Because if we had gone on lockdowns like the US and all that, like
for a long time, you would have gone past very quickly.
So we were actually thinking of things that we could pivot to during the COVID. But unfortunately, like the lockdowns came down, and then also we did a raise at that point.
Yeah.
So then it was like, in terms of the business, it went down. In terms of the fundraising, that really helped us. The COVID really helped us to do that.
Yeah.
Because in the COVID, people now understood even more so why you'd want to limit like people going and crowding in the hospitals and contacting and all that.
So let me ask you a more business question. So did you ever get to break even or even profitability before then?
No. So so we never, and it was interesting because that was actually one of the discussion points that we had. Because when we did our model from the beginning, we were going to get break even at 150 pharmacies.
Oh wow.
Because I think our model was optimistic.
By far.
Because we expected all these tests that weren't being done. Like we felt like once you put up this ability for people to actually test conveniently, they just go and do it. Right, and then we get to that point and we realize that no, like we get to even 500 pharmacies, we are nowhere near break even.
So what was the dynamic? Like you underestimating people's behavior?
I think we underestimated people's behavior, and then I think we overestimated sort of like the uptake, not from pharmacy levels, but from the customers. Because I mean, at the end of the day, even though we're doing B2B, we make no money if the B2C doesn't make C, right? So we sort of like we're modest on our pharmacy projections. but we felt like, oh, more people were going to go test in the pharmacies. And then we realized that no. Like the pharmacies really like it because this helps them to do their business.
But the customers, are they really uptaking it?
Yeah, they are really uptaking. And it gets down to I would say we had a bit of like Africa tax.
Yeah.
Okay. So one of the things that we said to ourselves when things weren't really working was that, one, if we did this in the US, we'll make tons of money. Because we were selling a malaria test for, let's say, $1.
Yeah.
There's absolutely no way you sell a malaria test for $1, even in
like
even in the poorest neighborhoods in New York, right?
$40.
And we would all buy from China.
Yeah.
So
the margins were
crazy.
We
we're making like cents on margin.
Yeah.
If we're in a developed country, we make like dollars. Like we make like maybe 50x.
Yeah.
So we realized that it was sort of like the African tax.
Yeah.
And if you strip, for example, the only way probably then RedBird would have survived in the form that it was before it's shut down would have been if you stripped away all the big founders, everything, all the overheads, and you just made this like a 2-man or 3-man business that is selling test kits. Like so I have we've got some people that have taken over that. They sell test kits, like they sell enough to pay their stuff.
Yeah.
So
you'll be break even just doing that, but not with all the paraphernalia,
all the paraphernalia. And of course, that is not what we targeted. Like so.
But can I ask you a question on that? What prevented you from launching in the US in a maybe small area just to test RedBird out?
Yeah. So I think Patrick, it was more of Patrick felt that we needed to do stuff in our because the problems that we had was not a US problem in our mind. Like so basically in the US, like I remember when I went to do public health, one of our classes, they actually said someone went to the hospital, I think waited for 45 minutes. So it was like a case study. So we were supposed to analyze it. Like he traveled from a place to another town to do the test and all that. And I analyzed everything. And I said, like the problem was like they had to make the guy move from. So it was actually like move from the rural area to the village to the city to take it. So I said that was wrong. Like that's a long travel time and all that. But like the positive things I said, like like 45 minutes wait time. Like, that's great. I didn't say
compared to your standards.
So when we're done with the class, I think the professor saw my notes and said, okay, you present. So I presented and everything. I was like, 45 minutes wait time. Like that's like super. And like the whole class was looking at me.
So
and I was like, why? Like 45 minutes? And you're like, how do you wait 45 minutes in the hospital? And I'm like, you spend a whole day in Ghana. So this is basically stuff that is that. So it's. I mean, hindsight, yes, we might have said, okay, let's test this out in the US and all that. I think, of course, then the regulations and all that, like the requirements and all that, everything changes. CLA, like the rules in the US were sort of more robust, more stringent than that. And we felt that the need was more in Africa. And the need is still there. We haven't cracked it. Nobody has really cracked it. But like we feel like the need is still there and we needed to build solutions. And we still believed in what we've done. I think it's what we've done, the pharmacies are still doing it. So it's not about the RedBird business idea. The RedBird business idea is great. The RedBird idea is great as a business. I think that's kind of where it didn't work.
So what got to the demise of RedBird? Without revealing anything,
it's not. So it's not. I think, and I still maintain we did great work, and people still tell me when I go around the pharmacies, like why, like people still, and it was surprising because people were actually willing to pay more. Like when RedBird went down. Of course, when RedBird was there, like they would not want to pay for things, but like they were like, we could have paid a bit more and all that. But I think as a business case. It couldn't stand on its own.
Oh, really?
It needed to be an adjunct, to do the RedBird thing, right? Because in terms of as a business, as an operation, it's on its works. But as a business, I think the revenues that you make from a pharmacy are low. So you take a typical pharmacy. The pharmacy has like maybe 2,000 products. We do 10. You get it. So if you look at and it's good business for the pharmacies.
Yes.
So
it's a way to return customers. They come back on a regular basis.
And most of the things that the pharmacies sell, the markups are 35%. For RedBird, they could actually do like 200% markup.
Yeah.
So when they take the bucket of 10 things, for them as a pharmacy,
they're good.
They're good, right? It's like they buy a test kit for 5 CD, they do the test for 15 CDs. That's like 2x, right? If they can't buy any product for 5 CDs and sell it for 15 CDs, unless you got it cheap from like a one-time supplier or something. Right? So RedBird for the pharmacies was good, right? It was good. It was very helpful. I mean, some pharmacies even took it like a notch higher, where like they keep the patient records, because we're keeping the patient records and all that. And RedBird for the pharmacy was good. But I think for us,
the demise was operation.
The demise was our operation, because I think the cost, it was kind of, we'd got into a point where like we needed now to justify like the big leagues. Like, so, okay, you've raised this amount of money, you've seen this number, these volumes, but like, how do you monetize the volumes?
How was it translated to actual revenue to justify the valuation?
So I think, hindsight, maybe what we might then have looked at is like, okay, how much more, like, okay, if you're getting the patient to take a test, that's not enough. What else can we get from the patient? Is it your medicines? Is there like, what other stuff can you get that makes up for it to the extent that, because RedBird, the testing was basically like very low volumes. I mean, pharmacies were making 200%, we hardly would make 200%, we would make like 30-40%.
So maybe to come back to a model that maybe could have worked, and then we need to move to the next stage, is, have you ever thought about having your own RedBird pharmacy on your own to test out all these things to see which part of the vertical you would integrate?
Yeah, so we thought about that, but we felt that we were, the number of pharmacies that we had gave us much more information than having our own pharmacy. So when you talk about the verticals, so we felt that if we had to do any of the verticals, it was better to pilot it with the pharmacies that we had on that. I'm not sure if I got the exact.
No, so let me explain again. So essentially, you started up as a diagnostic solution, testing solution for the pharmacies. What I was saying is like, you could have thought about setting up your own RedBird pharmacy to operate it and be not just a diagnostic, but the whole operation of it. I'm thinking Ilara Health, for instance, in Kenya.
Okay.
That does the whole setup of a pharmacy, and so it's XYZ pharmacy powered by RedBird, from diagnostics to all these other things. Do you understand?
So I think basically, I get a concept, right? So that would have been, we move into other things, right?
Yes,
once you open a pharmacy, you would basically move into the supplies, you basically move into like all the other shampoos and all the other stuff. And we still believe, I still believe that the way to go with that is not actually to do it yourself. It's actually to help the pharmacies to do it. So because
but you need to figure out a sustainable business model that makes RedBird worthwhile. You know, it's like I think that those two. I say those two approaches are different. Okay.
Because when you manage something, like it comes with. The mindset is different. The mindset is different. So I mean, that could be a model that would work. One thing that I personally like try to do. I'm not like not Robin Hood, but like I feel like the systems are already in place. I don't want to compete with them. I want to help them to improve, add value. So we felt like adding value, and the RedBird model, like we would have gotten to a point where we probably might even outsource the supplies. So we just deal with like the SaaS on that. So we would have gotten to that point. So maybe that point, and one of the things that we could have done was, we had a good distribution system for the test kits. We could have layered on
that more,
like the medicines, so because then the pharmacies do trust us. We could have, and it was one of the sticking points. I being a pharmacist, obviously that is like my go-to place. Patrick being like, he's a biochemist as well. So like he felt like the testing would have been good. I mean, there were other opportunities that maybe we could have tried out, maybe testing at hospitals and all that. But we did not do that.
So 2 more questions for you before we wrap up, because time is flying. So one is, how did the wind down happen? Did anybody come to try and acquire your assets? How did it work? That's number one. And then number two, we talked briefly about RIGELIS, but that I want that to be another episode.
Okay. So, I mean, the wind up, I give credit to Patrick. He handled all that.
Okay.
Some people try to acquire their assets.
Yeah.
I think what they were offering, like, it's still, like, it will give us more problems. Like, okay. So if someone gives you like a 50K when you're winding up, you've got investors, you've got like just trying to manage that becomes a problem. Like someone
who distributes what?
It's less on the investment, right? So, but then the process is tough. Yeah. So Patrick had to go through a lot of things. Had to sign like our founders' termination letters and all that.
Customers.
Yeah, customers. I think the customers, it was abrupt because I think so. I left RedBird in June. Shutdown happened in December. So the customers, I think it was because we're still trying to raise funds. We're still trying to raise funds, and I think the investors.
That's 22.
Yeah, that's 22. Yeah, so we're still trying to raise funds. I think the investors didn't believe in like the continuous RedBird vision. Like I think probably maybe. Anything. This is what they thought, but maybe they wanted like something else. Like you were saying, like could you have done something else? Could you do something else? Because they felt like maybe there's a limiting point that you could go to with the diagnostics and pharmacies and all that. So it was quite abrupt because we were still raising. I know that Patrick was in conversation with investors until he realized, like, look,
this is not gonna fly.
Yeah, just like, and then like if it continued, you get to a point where you actually might not even be able to like pay severance and all that to the staff. Like it's like, I mean, it's not like you owe them severance because it's gone down. But like it's basically we felt like, no, I mean, if you got like 2 months, don't let them work for 2 months. Let's rather give them the 2 months and then like so that people could wind down on that. And then you have to close the Ghana office, you have to close the US office. Like there are more regulatory requirements because we're the CE as well. On that. So that's how the wind up went. I think when the message went out to the pharmacies that RedBird was shutting down, like most of them didn't expect it. A lot of them called back. We are like, what can we do to make sure this still exists? Right. So I mean, I think it's
nice to customer testimonial.
It was really nice. I think we didn't do, I'd say it's like a company that really didn't do much wrong. We just found ourselves probably in the wrong space.
Maybe timing, COVID, some people benefited, some others didn't.
I don't think it's timing. I just, because I still tell people today, like I get people who come up to me and like, I can do RedBird, and I tell them you're going to fail. I taught them how they can do it. Like if you want to do it like a sales business, because one of our suppliers actually is doing very good. So when RedBird shut down, he's just a test kit supplier. He's not worrying himself with like any of their IT, nothing. And he's actually like doing really well. He's doing well. And you actually have 2 companies that are doing it, and both of them are doing well.
Oh, nice.
Like so, it's basically going on. Like he's realized like pharmacies would love to test pharmacies. But all he's doing is like he's doing a markup.
That's it. Buy, markup, sell.
That's all he's doing. So it's not like building like a community and network like it. And I mean, of course, you know the risk with that. Like anybody else brings a different product that's cheaper or something, like you start competing on that price. So that is fine. But it was a good experience. I think first off, we built a good team. The team that we built, and happy to like say like anybody that is any RedBird person, all of them have found jobs. And like the testimonials from where they are, like it's a way. Like I got someone called me the other day. It was like trying to hire a guy. Too good for the money he's asking for. And this was a kid that we picked from pharmacy school.
Oh, nice.
And it's like he's too good for the money that he's asking for, because like that we really like the thing that we had at RedBird. One of the things was the team. Like I felt if I was there and someone was trying to like hire the team. If you hire a local team, like you have to I still have some working with me.
That's called an acquisition. So we acquire a RedBird brand, but actually what you're recruiting is the team, not the tech, there's really an acquihire of the team. Oh, wow. So when you look at this RedBird experience, it lasted what, 4 years?
Yeah, lasted 4
years.
years. Yeah, like 5.
Yeah, nearly 5. Maybe if you are going to recommend things to founders going forward, what would be, let's say, the top 3 things to do or not to do? It's up to you to choose.
So I'll say document, like
processes. Document process.
I'll document your agreements, like
founder agreements.
Yeah, not so founder agreements, but like there are some things that you need to not necessarily even document, but like agree. Like, so for example, when we hit there's a disagreement.
Yeah.
How do we make decisions?
Like curing disagreements.
Yeah. Like, so you need to have those.
But did you have an advisory board or something?
No, so we did not have an advisory board. Yeah, so that's why I said like
governance.
It could be governance. So governance. So it could be that maybe you have an advisory board. You have someone that could break the tie or something.
Exactly. Yeah.
And I think secondly, discuss the long-term vision.
Yes. Okay.
So long-term, not 4 years, 10, 15 years.
Yeah.
Discuss the path, the end goal.
Yeah.
Right. So that when you have a disagreement, you can come back to
that vision.
To that vision. I think that is very, very important.
Mm-hmm.
And I think stay true to yourself. Like, this startup thing it needs to be something you're interested in. Not just interest, but something you're passionate about. Because it's tough. It is tough. It will beat you up. Like it's you have to be able to wake up and feel like I'm not giving up on this.
Yeah.
It basically has to be like maybe your health.
Yeah.
Like if you're not feeling well, you're not going to say, "Oh, I'm not feeling well. I'm going to die." Like you're still going to want to get out of it. Like you need to be passionate about that, and treat your customers well.
Yeah.
Like treat your customers well. Your customers, your staff, like treat them very well. Like. And listen to them. The last thing I would say is be open-minded. So I said earlier on, have the vision ahead, but be open-minded. And so I live by a mantra like, I'm never satisfied with anything. And I know it's hard, especially when I'm dealing with people, it's really hard.
Yeah.
Like even what I'm doing, I'm not satisfied with it.
Yeah.
Like I always live with the assurance like, okay, think and think again.
Yes.
So I think this is great. I'm coming back tomorrow.
And then think again.
And think it again. Like, because oftentimes I realize that when I think again,
it's better.
It's better. Like, so, and I don't stop. So it's sometimes very frustrating working with me. My team, I had to like.
So you're demanding one thing better. But sometimes perfection is the enemy of results.
So I'm not a perfectionist. Interestingly, I'm not a perfectionist.
Okay.
Like, so I told my current CEO, I'm like, we are doing models, and I said, look, Gabi, 95% of them, like, you're talking about 5%. I don't want. So go spend the time. It's an actuary. Go spend the time. Fine tune that. I've done 95. I'm okay. But I feel that the thing is, it doesn't matter where the idea is coming from. Once the idea leaves your head, don't own it. And I think don't be emotional about your ideas. Like, so if something comes up for me and I'm like, okay, we're doing this, we're making this thing blue. Once I'm done, it is not the fact that I said this thing should be blue. This thing is blue. So I'm attacking this on the fact that this is blue. So if I feel like it has to be green, I don't care that I said it should be blue. So that's basically one. So I think I've said a lot. My thing is like have a disagreement, like sort of like governance structure, decision making structure. I think governance probably my body, decision making structure. Have that. Be passionate about what you do. And be very passionate about what you do. And then I'm always like. Think and think again.
No. Really, it's been great having you here, Andrew. I want us to discuss briefly Rigelo.
Okay.
Tell us what it is, and then we'll come back to another episode.
So RIGELIS as RIGELIS Inc. Basically, what we are doing is we are building a convenient, affordable healthcare for 1 billion people in sub-Saharan Africa. And the whole idea is that we feel like just the same story for the RedBird. Healthcare is getting to a point where purchasing power is decreasing for African people. Like time of a constraint. People need good healthcare. So we want to be able to do that. Of course, the current options that you have hospitals, you have labs, you have pharmacies, you have telemed, you have so much stuff, right? we feel that, okay, we need to do this. We can't do all at once. So we are starting from the pharmacies. And the reason we are starting from pharmacies, the pharmacies are like conveniently located everywhere. They are manned by trusted professional. We've done our survey about like 65% of people use a pharmacy in the last 30 days.
Yes.
So it's where people already go. So we've looked at that. I being a pharmacist is also part, but we've looked at that. And we've seen the community pharmacies need a lot of help. Like you go there, you see legacy software, software that is like commerce.
Yes.
Yeah. So what we are building is we build a software that is a care-driven software.
Yes.
Still takes care of your commerce.
Yes.
It takes care of your commerce, but then also as a pharmacy, one thing that I learned from RedBird when we went there is if you're a pharmacy, you go to a pharmacy. Let's say a patient came in with insurance.
Yeah.
And you wanted to do a test. So this is what you do. You sell the test kits to the patient on your POS software. When you're done, you take the RedBird app, you register the patient in the RedBird app, and then you record the test. If you have to bill insurance, you take the insurance app.
Yeah.
And then you now have to bill. So you're there's a multiple. If that patient actually is a it's like teleconference, like a telemed, then you'd have to connect to the telemed for them to do that, and then like do WhatsApp. So like you're basically having channels of things. So for us, is what we are building is like, look, we are building a healthcare system, but we're starting from the pharmacy system. We build a tool that is a plugin.
Yes.
So we're not going to build all the other portals. We may build some, but like the tool first of all works for the pharmacies, and then it's connecting us. So right now we have 135 pharmacies in 2 years, almost 180% annual growth rate in 2 years. We are very excited about that.
Let's stop there. We give them more later. So Andrew, thank you very much for visiting us at Talk, Tales of an African CEO.
Yeah.
Subscribe, share, and comment. Thank you.
Thank you. Nice having you.